Africa, an NGO focused on bringing accessibility of healthcare to underprivileged and poor communities across Ghana and other parts of Africa. We have been operating in Africa since 2010. Each year, we provide medical supplies through partnership with our partners in America and other countries, and bring into the country several medical equipment and supplies and donate them to hospitals in villages all across the country. We have visited so many regions, from the eastern region, central region. We are now in the Ada East region, where we have come to Pediatokope Clinic as our second health fair in our last quarter of 2018 health fair. And it's quite interesting and amazing, the discoveries that we had made here, and I'm going to share with you. We have come to the Pediatokope Clinic. It's a very comprehensively large infrastructure that serves over 24 communities and 6 islands. Imagine 24 communities and 6 islands. And this facility, the infrastructure itself is there, but the contents of the hospital is what is quite questionable and extremely disturbing. Quality Health Africa has been operational since 2010. We bring in the country several medical supplies, and we have screenings each year where we screen from diabetes, HIV, malaria, blood pressure, typhoid, hepatitis B, blindness, dental, all kinds of screening that is needed depending on the communities we are going to. Pediatokope over here this evening, I have been very saddened. When you go to all the different departments in the hospital, it has basically been abandoned to rotten. The communities here are in need of so many things, but very, very little accessibility. They are understaffed. They have only 8 people serving this entire community. In a community that serves over 30 different communities, which includes 24 communities and 6 islands, there are just 1 senior enlisted nurse, 1 senior nurse, 2 enrolled nurses, 1 ward assistant, 2 community nurses, and 1 midwife. This is quite outrageous. And I must say, when you enter the facility and you see antiquated and broken beds in the maternity ward, maternity wards where mothers and babies need special attention and care, everything there is rusted. Medications over there are expired. The equipment there are rusted and need to be dumped and thrown away. The most basic accessibility to healthcare, these people don't have. This is the delivery room at the hospital. These are the beds that a new nursing mother is put on with her child. These, you be the judge for yourself. I don't have to explain this to you. This is where a newly born mother, these windows, very dusty. You can see for yourself. So this is where a newborn baby is put. Imagine the infection that the baby can get. Come over here. This is the delivery room. And as you can see, these gloves have been used for days or even weeks and have not been disposed. The kind of bacteria and infections that this alone can create. This here is the delivery room. Imagine the dust. Such an open room with all kinds of dust coming in here. If a mother, is giving birth, all the kinds of dirt that can get into her system.
So, in case we are doing transfusion, blood transfusion.
There's no transfusion here. So if there is a need for
really,
you have to put them on the clinic. Yes. Most of the medication here, the supplies here have expired. Some as far back as 2016 and 2006, and it's being used. This kind of neglect, I think, is inhuman and is quite tragic. We've never encountered a situation so atrocious, and something needs to be done about it, because as human beings, we all deserve equality. I think no human being's life is more valuable than the other. We are crying out to all organizations, both nationally and internationally, to come to our aid, to partner with us so that we can provide this community and other communities across the country who are facing similar or worse situations, to provide them the help that they need. And it's quite amazing and terrifying. I'm really very disheartened by what I'm seeing here. This was not what we expected coming here. Imagine the kinds of beds that pregnant women and newly born nursing mothers are laying on, or the kinds of supplies and equipment available for them to seek. This breaks my heart, and this is the real problem on the ground. This is what is needed to strengthen and improve the healthcare system in the country. It's quite fascinating, and this is just one section of the facility. This is sad. We're going to stop here, and I'll take you to the next wing of the facility so you can see what else is going on. There are limited lab equipment here. There are no lab technicians, and one of the reasons is the accommodation and accessories and amenities for the lab technician to come here. It's not there. So now this place, a huge facility which serves 22 communities, basically the whole island, does not have a lab technician. So in case of an emergency and they need to be labs taken, people have to take a canoe, travel to dry land, and then take public transportation to a district hospital before they can get lab services done. Common lab services. And if a patient is sick, considering the poverty rates here, the money and the willingness to go all the way to the district hospital, even the money is going to cost them to get to the facility, they are reluctant to go. These are some of the fundamental problems that is affecting healthcare in Ghana. We have been all around the country. We were at the Western region in Bodriasi yesterday, and similar problems are persisting. And so it's really a cry and a plea that we need these basic assistance from our government institutions. You know, they are doing a lot of work, but these common things is what we need to bolster the healthcare system in these villages. It's quite sad. It breaks my heart because the more I dig into the rural parts of Ghana, the more heartbreaking and sad I get, because the situation on the ground is very sad. And it also energizes me because Quality of Africa have a mission to strengthen the healthcare system in Ghana and the rest of the sub-Saharan sector. So we are going to need all hands on deck to make this happen, because all lives do matter. There is no life more important than the other. And the people in this part of the country also deserve, I repeat, deserve a quality accessibility to just quality and basic health care. This year we brought $500,000 worth of medical supplies. We have donated some to the Bodriasi clinic, some of the clinics in the eastern region, and today we are at Pediatokope. To be honest, we underestimated the needs here. As a non-profit organization, our mission is to do what we can, but this is a mission that we cannot do alone. We need massive involvement of government, because this is quite sad. If this is the country that we are expecting to grow and be the beacon in Africa, then there is so much more that needs to be done. And it's about time that we as Ghanaians stand up, take charge, and demand quality healthcare services for every Ghanaian, not only the Ghanaian that can afford it. That is not democratic. I think democracy is the ability to provide accessible and quality basic healthcare to every Ghanaian. Every Ghanaian, every child here. I've seen so many children here that resemble my daughter, who is 4 years old. They all deserve to have equal accessibility to healthcare. This is the only way they can be healthy enough to get the education they need, so that they can be the leaders that we need in our country in the future.